Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. First of all, let me introduce our team. My name is Harfiana Nafisa.
My name is Faizal Nugraha.
My name is Levina Hadi.
My name is Safina Insania.
My name is Sakila Maharani.
My name is Piano Hidayah.
We are from the fifth group. Today, we would like to talk about COVID-19 vaccination in Indonesia. Next. What is a vaccine? Vaccines are biological products that contain antigen that when given to a person will give actively specific immunity to certain a disease. And what is the purpose of the vaccine? Of course, the vaccine have a purpose. And the purpose, there are 4 points. The first, forming group immunity. Second, decrease pain and death from a disease. And the third is protecting and strengthening the health system as a whole. And last is maintaining and minimizing social and economic impacts.
Is vaccine important from a pharmaceutical point of view? Of course, yes. With vaccinations, the likelihood of contracting the disease is smaller, and if contracting the disease, the severity that is felt is lighter than for people who are not vaccinated at all. Next. What is COVID-19? Next. COVID-19 is a disease caused by severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2. COVID-19 can cause respiratory system disorders ranging from mild symptoms such as flu to lung infections such as pneumonia.
What are the causes of COVID-19? COVID-19 is a disease caused by severe acute respiratory syndrome, coronavirus 2, SARS-CoV-2. COVID-19 can cause respiratory system disorders ranging from mild symptoms such as flu to lung infection such as pneumonia. What are the symptoms of COVID-19? In general, there are 3 common symptoms that can indicate a person is infected with COVID-19. Namely, the first is body temperature above 38 degrees Celsius, and the second, dry cough, and the last, shortness of breath. How to vaccinate in Indonesia? Vaccines contain antigen substance or compounds that are made in such a way that it does not cause pain, but is able to stimulate lymphocyte cells to produce antibodies that can protect themselves from coronavirus.
The criteria for people who can be vaccinated, they are not criteria or according to the Ministry of Health, including 1. Do not have chronic diseases, such as heart disease, autoimmune, etc. 2. Not having an acute infection accompanied by fever, cough, runny nose, diarrhea, and others. 3. Not pregnant. 4. Do not have family members who are COVID-19 patients or are currently undergoing COVID-19 treatment. 5. If during the health screening you have a fever or body temperature is above 37.5 degrees Celsius, then vaccination will be postponed. You will be asked to do an examination regarding the symptoms you are experiencing and visit the same health post. If the cause is not COVID-19 and the temperature has returned to normal, then vaccination can be done by screening it first. 6. People with controlled type 2 diabetes and HbA1c below 58 mmol per mol or 7.5% can be vaccinated against COVID-19. 7. If you have a lung disease such as asthma, COPD, or tuberculosis, then vaccination will be postponed until you are well. 8. For people with TB who are still being treated, vaccination can be given after 2 weeks or HIV anti-tuberculosis drugs. 9. If at the time of health screening you had a blood pressure above of or equal to 180 per 110, it means that vaccination cannot be given. Next.
How is the vaccination process in Indonesia? Next. The beginning of the arrival of vaccines in Indonesia. The arrival of vaccine in Indonesia until now, Indonesia has arrived for vaccine raw materials and ready to use vaccines up to stage 4. For the first stage, Indonesia arrives of vaccines on December 6, 2020, totaling 1.2 million doses of ready-to-use vaccines. Then for the second stage, on December 31, 2020, a total of 1.7 million doses of ready-to-use vaccine. Then for the third stage on January 12, 2021, 15 million doses of vaccine raw materials, and for the fourth stage on February 2, 2021, 10 million doses of vaccine raw materials plus 1 million overfill. A vaccine that can be circulated in Indonesia. Minister of Health Budi Gunadi Sadikin has determined the COVID-19 vaccine circulating in Indonesia in the decree of the Minister of Health number HK17 Menkes 12758/2020. The following is a list of the COVID-19 vaccines circulating in Indonesia in the decree. The first is Sinovac, the COVID-19 vaccine made by a Chinese pharmaceutical company. Sinovac Life Science Co. Ltd. is an inactivated vaccine for dead virus. The second is Novavax, the COVID-19 vaccine made by a biotechnology company from Maryland, US, with the code NVX of 2373 was developed and the result of early phase clinical trials for the COVID-19 vaccine candidate were announced on Tuesday, September 22, 2020. The third is Oxford AstraZeneca COVID-19 vaccine. Oxford AstraZeneca or AZD1222, also known as CHAdOx1 and COVID-19, is a COVID-19 vaccine developed by the University of Oxford and AstraZeneca. This vaccine is applied by injection into muscle tissue. The research was carried out by a team of researchers from the Jenner Institute and the Oxford Vaccine Group of the University of Oxford. The fourth is Sinopharm vaccine. The vaccine developed by the Sinopharm's China National Biotech Group affiliate is the same as the Sinovac vaccine, which use an inactive virus that cannot replicate in human cells to trigger an immune response. Clinical trials registration data shows thus are required for this vaccine to be effective against the coronavirus.
Okay, next, number 5, Moderna vaccines. Quoted from the journal, the Advisory Committee on Immunization Practice Interim Recommendation for use of Moderna COVID-19 vaccine, United States, December 2020. The Moderna vaccine is an encapsulated lipid nanoparticle vaccine, include mRNA vaccine modified nucleoside glycoprotein boost stabilized from SARS-CoV-2. The virus that caused the 2019 coronavirus disease. Number 6, Pfizer COVID-19 vaccine. Pfizer COVID-19 vaccine is a vaccine developed by Pfizer-BioNTech. The active ingredient is messenger RNA, which carries instruction for making nail proteins such as those in the COVID-19 coronavirus, SARS-CoV-2. The spike protein, which plays a role in the virus, can infect cells. The active ingredients in the mRNA in the vaccine itself is synthetic, not extracted from live SARS-CoV-2. And the last, COVID-19 vaccine produced by PT Bio Farma. Bio Farma is currently producing Sinovac vaccine, which come in large quantities in the form of raw materials and finished vaccine. As many as 25 million doses of vaccine were imported, namely 15 million doses on January 12, 2021, and 10 million doses on February 2, 2021. And meanwhile, 3 million doses of the finished vaccine were previously imported. Next. What are the important roles of a pharmacist in the COVID-19 vaccination program? The role of pharmacists who work in certain pharmaceutical industries has the responsibility of providing vaccines, whether imported or self-produced. In addition, related to COVID-19 vaccination, it is responsible for distributing the vaccine chain so that the equality of the vaccine is maintained, safe and efficacious. The second role is good communication of vaccination to the public based on the scientific facts, so that people are motivated to be vaccinated. And the third role for pharmacists in the service is to participate in reporting any follow-up even after a vaccination. Next. So it can be concluded that all pharmacists in Indonesia are expected to be able to make the COVID-19 vaccination program a success, either the one currently prepared by the government or the regular vaccine which will be available in stage. I think it's enough from us. If you have any question about anything, feel free to interrupt. Thank you for your attention and wassalamualaikum warahmatullahi wabarakatuh.